I'm Corvallis Advocate Editor Stevie Beiswanger, and co-moderating with me tonight is our publisher, Steve Schultz. Welcome to tonight's CitySpeak Forum. This evening, we'll take a look at the pandemic. We'll take a local look at the pandemic, its trends and anticipated health impacts, and how to grapple with staying mentally healthy and resilient through this challenging time. After tonight's CitySpeak, we'll take a hiatus for a few weeks before returning in September. These forums are presented by the Corvallis Advocate, which offers daily news online, and in non-pandemic times, a twice-monthly deep dive print publication, along with live forums and storytelling nights. City Speaks are co-presented by City Club of Corvallis, a volunteer-run nonprofit organization seeking to present a diversity of viewpoints and constructive dialogue. Steve?
Thank you, Stevie. You can support forums like these by donating or subscribing to the Corvallis Advocate. If you're not a subscriber, it's only $5 a month for unlimited access. And also, if you're not subscribing, you're about to consume content without taking care of the people behind the scenes that work really hard to make this happen. You wouldn't do that to somebody that makes your pizza or your cup of coffee at the coffee shop. So please do consider a subscription, $5 a month, unlimited access, or you can add some services or a donation over and above if you're so inclined. Along these lines, I want to thank the folks, and the folks at the Corvallis Advocate want to thank the folks that are sponsoring this evening's program so we can kind of afford it. First Alternative Natural Foods Co-op and Peak Sports. Stevie.
Thanks, Steve. Without further ado, I'd like to introduce this evening's panelists. Joining us tonight are Charlie Fawton and Danielle Brown. Danielle Brown, the interim co-directors of the Benton County Health Department, and Janice Svoboda, a clinical social worker with a local private practice and 35 years of experience. A big thank you to our panelists for taking time out of their busy schedules to be here. In a few moments, we'll turn to audience questions. To ask a question while we're live, viewers can comment on the event's live post on our Facebook page, The Corvallis Advocate, or email us at cityspeak@corvallisadvocate.com. Again, that is cityspeak@corvallisadvocate.com. For now, we'll start with introductory questions from our editorial board. Steve?
Thank you, Stevie. Charlie, so, over last week, what we were hearing was, well, okay, Benton County is no longer meeting the benchmarks for the reopening to the extent that it had reopened. Where are we at today? And what do the numbers look like, most specifically as percentages?
Right. Thanks, Steve, and thanks for the opportunity to be on. Really appreciate it. Yeah, this is somewhat of a problem, but we're not in serious trouble in Benton County. There are a series of benchmarks that we are measured on. Every county in the state is measured on, and we have been meeting those since we entered phase 2. Unfortunately, in the last 2 weeks, our trends have been negative. And in the last week, we went 2 straight weeks without meeting all of the benchmarks. And so the governor did add Benton County to the watch list, which is a list of counties that are not meeting benchmarks. It is not punitive. There's no additional limitations on those counties, but it is a warning to us and statewide that trends are going negative. And it is not just Benton County. Most of the benchmarks that we have been negative on are also negative statewide. Probably the most important of those are cases that we can track to and trace them to other known cases. We want this to be a very low percentage, and unfortunately, it is really increased. What that means, so we have 83% of our cases that we can track to others, but that means 17% are not traceable to other other cases. And that means there's more community transmission of this virus. Initially, the cases we were finding were linked to known cases. We had some small but significant focal outbreaks. Those were the sources of our cases. Now cases are popping up here and there around the community on their own. I liken this to a wildfire that's throwing off sparks. And unfortunately, we in the population are the fuel. And where one of these sparks lands, lights up a little fire, that's a case. And that opens the opportunity for further spread. So that's been a worrying. Previously, we had about 50% of our cases that we called sporadic like that. In the last month, that's gone up to over 75%. The other worrying trend, and it's not one of the state benchmarks, but it is something that we really watch, and that's the proportion of cases in younger people. We know this disease is more dangerous for older people and people with more cumulative pre-existing conditions and underlying health problems, but younger people are more social and get out more, gather more, but they also mix with those older, more fragile people. And when we see an increase in cases in these more gregarious populations and younger populations, it is worrying. Previously, the first couple of months, we were seeing very few, 10 to 15% of our cases were in under 30-year-olds. Then for about a month, we were around 25%. Now we're pushing 70% of our cases, mid 60% of our cases are in people 18 to 30 years old. And that's a worrying trend. So that's not a state benchmark, but it is something that's significant to us epidemiologically.
Is a piece of that because those people that are in those younger demographies are in spaces in their career where they may be less likely to be working in a remote circumstance. Over time, we're seeing that, I guess what I'm really asking is if you're younger, maybe you're working as a checker in a market, where are the cases coming from?
Well, I think
in that demography.
Yeah, it's multifactorial. There's certainly those folks. It is a hardworking population. It's a population that often works, in more active, interactive employment. Whether that is, physical labor, but it also, I think, is a factor of some of the messages that went out earlier, which seemed to indicate, and I think rightly so, given what we were seeing early on, that this disease is most dangerous for older people. But the underlying corollary to that, which is not necessarily true, but I think came through for a lot of people, is that younger people really didn't have to worry as much about this. And I really think, between the immortality of youth, the gregariousness of youth, and these messages that there was less to worry about, I think it's also a population that didn't take their precautions as seriously and gathered more, ate and drank together more, didn't stay in the same small group of people, but had multiple groups that they interacted with. And so the risk factors went up that way. This is not altogether unanticipated. We thought this may happen when we went to phase 2 and sit-down dining opened up and bar times were extended, more activities were allowed, but it took some time to take hold, and we knew that would be the case. It would be multiple incubation periods. It wouldn't just be that 14 days. And we were saying when we went to phase 2 in early June that we would see the consequences of that in about mid-July. And sure enough, I think that is a consequence that we are seeing.
So do you have some sense of forecast it sounds like you do look ahead. You have some sense of forecast, where we may be, but this time next month. It sounds like it takes about a month lag time.
Yeah, it's a worrying trend, quite frankly. As I said, with an increase in cases in more active gregarious populations, a certain proportion of those people are going to be in contact with older, more fragile people. It's also a disease that is often minor, even in older people initially, and then gets worse. We do, in the younger population, we do have a fairly high obesity rate. We have a fairly high diabetes rate. We have a lot of smoking and vaping, and all those have been shown to be predisposing factors to more serious illness. There are places in the country that are seeing hospitalizations and very serious illness and even deaths going up in younger people. We have not seen that yet, but our increase in numbers in younger people really, I think, have just started. So I'm frankly, I'm
Are you
worried.
forecasting we're going to see more?
Yeah, frankly, I'm quite worried.
And what age is there? You say youth. I mean, what age range do you mean?
The biggest bump is in 20 to 30-year-olds. We are seeing some increase in younger people, continuing to see some in older people, but fortunately, I think recently, knock on wood, we have not seen new outbreaks in long-term care facilities and places where congregate groups of very fragile older people are living. Those organizations have really taken extreme precautions. They're not out of the woods as long as the virus is around. There's a hazard there, but this trend to more sporadic spread in the general population is worrying because we do have people in the population who have had organ transplants, who are immunocompromised for one reason or another, who have pre-existing underlying illness that we often associate with older people, but it's not exclusive to that. So I think the hazard is there.
Okay, and at congregate living, in the beginning, you're seeing this in assisted living and nursing homes to some extent, and I guess prisons as well.
Absolutely.
Yeah, I guess any institution where there's congregate living. Um, is that declining because those facilities have figured out better how to operate?
Yes, in many cases it's true. Um, the prisons are still a challenge nationwide, and in Oregon, it's a very difficult environment to control any infectious disease and especially respiratory illness in. The long-term care facilities are certainly taking very extreme precautions and actually doing a lot of testing of employees. Those are the people that are in and out. By and large, a lot of those facilities have really limited family visitation and resident entry and exit. Um, and so there's been a lot more attention paid to the employees and assuring that the illness is not coming in. In Corvallis, in other places, congregate living has included living situations, group living, dormitory, bunkhouse for agricultural workers. That's been a huge problem in Northern Oregon and in Central Washington. We don't have much of that in Benton County or in this part of the Willamette Valley. But in Corvallis, what we do have is a lot of group living, again, in these younger populations. Whether that is rental housing units, condo units that students are in, Greek housing for sure. Those are very lightly occupied right now, but with the increase in activities at Oregon State University and the plans for increasing on-campus activities in the fall, we have been working very, very closely with Oregon State University to implement surveillance and monitoring education programs to really try to limit congregations and limit transmission in those congregate living facilities, not just on campus, but all through the community that are associated with OSU.
And then, you know, I'm going to ask, I guess, two other quick questions. One of them is quick, one of them is maybe not. Um, we're now on a watch list. What does that mean? Is there a point at which either locally, I'm assuming our local government rather could decide to further restrict businesses if it chose. But more likely that's going to come from the state. Could you unwrap why for a minute? And then do you see that as a likelihood in a month or two if transmission keeps increasing?
So to the first point of local action, while it's possible, I think it would be less effective. We have a really mobile population, a really mobile work population, and particularly those service workers that you mentioned earlier, primarily because of our housing costs. A tremendous number of those construction workers, agriculture workers, service workers, the lower paid folks live outside of Corvallis and outside of Benton County and commute in. And so, you know, local actions would, I think by definition, have less impact than something on a regional or statewide level. It's possible, but I think it would be much more effective were it to happen statewide.
And is that likely to happen if transmission rates keep increasing in younger folks?
I think it's not unlikely. As a matter of fact, the governor has a news conference scheduled for 11 o'clock tomorrow to discuss these trends and to discuss the progress on this pandemic statewide. You know, the last couple of times that we've seen those, we've seen statewide mask orders come down. We've seen greater limitation on groups, you know, down to 10 people per group. And it would not surprise me at all, even tomorrow, for the governor to impose new limits or at least outline what those may be.
Yeah, you have any suspicions what they might be or no?
No, they're pretty closed-mouthed at the governor's office, even within the public health system.
You get a rumor now and again, not often, I don't.
But we would be surprised to see more limitations.
Yeah. Okay. And then, but they could close down to some extent bars, restaurants again if it got that bad.
Absolutely. Absolutely. They could go to full scale, you know, back to phase one and, you know, limit elective medical procedures and, you know, wind bars back to a 10 o'clock closing time, abolish sit down dining, you know, the restrictions that were in place earlier on. It's certainly possible.
And then I'm going to ask you one last question, and then I'm going to turn it back over to Stevie to interview Danielle and Jana. But you know, this months ago was a new virus. It's still, you know, it seems like we've been, you know, because we're with it every day. It seems like we've been with it forever now, but really it's just months old. We're learning at an incredible clip. I know, you know, initially there was don't wear a mask. Now there is wear a mask. Some of that may have been pragmatic, trying to keep PPE to health professionals for a little bit as production was being ramped up. I have no idea. But some of it may have been the science catching up with trying to figure this out. And I guess my question is, what do we know that we didn't know 3, 4, 5 months back? What are we learning about the virus? What are we learning about managing this pandemic for what it is? What do we know now that we did not know?
No, great questions. And I know, you know, these changes in recommendations, changes in facts can be really confusing for people about what we're actually experiencing is watching science happen in real time. And we don't often see that. We occasionally see it with food recommendations and things like that. What causes cancer? And it can be really confusing. Last week it was chocolate, and now chocolate's good for you, that sort of thing. These are confusing messages. I think what we really know is, and it's pretty wonky, it's inside baseball stuff for those of us in public health, but early on, there were some assumptions and we didn't know. We were guessing that this pandemic may roll out sort of in the pattern of 1918 in waves, that we'd have an early upswing and then a bit of time off, and then watch out for the fall and winter. And that happened about 3 times in 1918. What we've learned is this is not a flu virus. This is acting like a coronavirus, and a coronavirus is out there. It's like a common cold, or we have coronaviruses there. They're always looking for that dry tinder. It is the sparks in the fireplace, and wherever they find them, it really doesn't matter the season. Where there is openings and where there's weakness and where their precautions go down, it's going to catch fire. We know that the mask precautions, respiratory precautions, social distancing work, and they are still working in many, many places around the country, around the world. I think the problems that are occurring around the US, and thank goodness to a lesser extent in Oregon, but still to a worrying extent, are the result of a relaxation in those precautions. And this virus is going to take advantage of those regardless of the season. It may well get worse in the winter when the doors are closed and we all have to be inside in air handling systems, and we by necessity have to be closer together. So we will really have to worry about that. But while that's happening in the summer, I think that is one thing we've really learned, that this is a very opportunistic virus.
So it's opportunistic, like a cold, but far more serious, apparently. Yeah.
Far more serious.
Yeah, we know more about that now too.
Yeah, even the people with so-called minor illness, this is not a 3-day cold or a 7-day flu. People are, have memory problems, have cognitive problems, lose their energy, have coughs and serious respiratory illnesses, problems climbing stairs for weeks at a time. Even young, healthy people who are not in danger of being hospitalized and not that ill, really are getting knocked back by this thing in many cases. And so we did not know that early on, because the other coronaviruses, the common colds, are not that severe.
Yeah. Okay, I appreciate the time, Charlie, and I want to turn it back over to Stevie Beiswanger to interview Danielle and Jana. Thank you.
Yeah, thanks, Steve, and thank you so much, Charlie. It was very enlightening for me as a 20-something-year-old. Danielle, let's go to you, and we're going to kind of shift the focus to substance use during the pandemic. We've seen monthly spikes in alcohol and marijuana sales reported from the beginning of the pandemic. My question for you is, are you seeing increased substance abuse caseloads locally?
So we aren't seeing increased caseloads quite yet. I think we won't probably see them for another few months as people continue to try to cope with the coronavirus emergency and all the stress that is coming around that. What we see with addiction is it usually takes a few months or years in some cases to develop into a full-blown addiction pattern. So I don't expect to see these increased caseloads probably at least until the winter or even further down the road than that. We are seeing people come in with increased stress and increased anxiety, but not so much increased substance use access. I haven't run the numbers, but I would be curious if there are more DUIs or anything like that that are being caught by law enforcement. I haven't tracked any of those numbers well. Addiction is an interesting disease. It can take some people months, some people years, some people a lifetime to develop full addiction patterns. So, in the younger population, it's going to take longer for those addictions to look like addiction problems. What you see is people saying, "Oh, I can stop whenever I want." And unless and until there's some really negative consequence, a lot of times we don't see people coming in for treatment until they have to. So, I think we're continuing to work down that path. I think we're going to continue to have people use substances to help manage stress and anxiety and depression and everything that's coming with the emergency that we're dealing with right now. And it's going to be this is a long game. This isn't something that we're going to be over, even best case scenario, they get a COVID vaccine, and then let's say next 6 months to a year, which I think is really optimistic, but let's just, for argument's sake, say they do. We're going to see addiction patterns continue for probably 2, 3, 4 years beyond that before we see those caseloads really increase connected to the COVID emergency.
Yeah, and talking about stress and anxiety, have you seen an increase in mental health caseloads, or as far as new patients, or a more frequent need for intervention in that way?
Yeah, we are seeing people coming in asking for new services. We changed our admission pattern when the COVID emergency first started. We actually paused doing any new intakes because we wanted to give staff time to adjust to the COVID emergency also. We've reopened our intakes, and we're booked out assessments about 2 or 3 weeks at this point. I think we're continuing to see individuals come in requesting services, requesting counselor of the day. We have seen an increase in our existing patients being admitted to the psychiatric hospital, the inpatient unit. And I think that that's all related to the stress around the COVID emergency and people just not really knowing what to do with all the anxiety that they're feeling, that is just feeling like it's airborne at this point. It's everywhere you go, it's everywhere you look, and people just don't really know what to do with that. So, we do have, Benton County Mental Health started a new skills group called Skills for Psychological Recovery. That's open to any community member that needs it. They don't have to be an existing or open patient. We haven't seen a big request for access for that. I think partially because people are still just trying to hunker down and manage their own individual stresses and anxieties and family life, with kids being out of school and everything that's connected to that. So we're going to continue to have that available to people as they need it. It's free. We're not charging for it. Again, you don't have to be an open client. So everybody is welcome to come and access that service.
That's great. Thank you. One more question, and then maybe I might have a follow-up. So back to substance abuse, we've heard of a possible second pandemic in a few years. Do you have any thoughts on that?
Could you explain more what you're asking?
I might have Steve take the reins on that, if you could. You're muted.
Sure, Stevie. A couple of things, though. First, could everybody convert over to speaker view? Great. Okay. If you all do that, then we'd appreciate it. Okay. Really, at some point or another, there's a delayed, people start drinking heavily, but it doesn't behave like a problem in their life for some amount of time. But then after a while, yeah. And when are you expecting to see that wave of people that go, wow, I've got a problem? I don't know if it's months later, years later. Is there going to be a wave of that at some point?
I do think there's going to be a wave of that. I think we're already struggling with addiction being a big problem just in the world right now. And then when you add something that's as stressful as the COVID emergency, people losing jobs, kids being out of school, I think we're going to continue to see people use, people use because they're looking for that quick fix, for that thing that's going to immediately decrease their anxiety and manage their depression, regardless of the long-term consequences of that. So I think we are going to see a wave of individuals needing treatment. Probably, it could be anywhere from 6 months to a year to 2 years. And I think that's going to vary based on the functional needs of the individual. It could be, once people go back to work, they start to realize that their use patterns are problematic. If individuals don't go back to work, it's likely to take longer for those realizations to occur, because people are just going to continue to try to do the best they can to manage the stress and anxiety. So it could be 6 months, it could be 2 years, and I think part of that is dependent on how quickly we can manage the COVID emergency and the outbreak related to the coronavirus.
Great. Stevie, I'll turn it back to you.
Sure, and I think
Thank you, Danielle.
Thank you. The missing loop to that question may be about a second pandemic. I've seen articles, scientists telling us this isn't it, that there might be more down the road. And is that kind of what we're pointing to, the complications of long-term patterns of abuse of substances, addiction, and then the possibility of that arising too? Do you have any comment on that, Danielle?
Yeah, I think if the coronavirus continues to be at the level of stress that it is right now, when there's a second wave, if there is no vaccine or effective treatment, people are going to continue to do what they can to manage the stress and anxiety. So I do think that if there is a second wave, or God forbid, some other illness or natural emergency or whatever the case may be that occurs, we're going to see significant use and abuse patterns, significant needs for mental health services, and significant dysfunction with people that are just trying to manage their stress and anxiety.
Thank you. My only other question for you is, aside from the skills program you've mentioned, do you have any other kind of resources people can access locally who are undergoing stress right now, anxiety?
Absolutely. We have Counselor of the Day that continues to be available. That's available either coming into our 27th Street location by phone. We want to try to accommodate the access for individuals who maybe are not comfortable coming into the clinic. We understand and respect that. We continue to have outpatient treatment services. Individuals can call our main number to ask for an assessment to be scheduled, and we can get an assessment scheduled so they can come in and see a counselor. We're doing most of those via telephone or telehealth at this point. We're not seeing patients in person. There's just too much risk to the clients and to the staff that are providing the services. So we continue to have our full array of services available in addition to the new SPR groups that we're providing.
Thank you so much. And I'm going to move to Jana now. Jana, thanks for being here. And we wanted to touch base with you on self-care, a good segue from what we've talked about so far during the pandemic. So just for some, the shut-in has been a really isolating experience, which might be exacerbated by fear of being ill or financial loss or strain. Can you offer some coping strategies or productive steps for people to take right now?
Yeah, first, I think it's really important to acknowledge the breadth of the losses that we're having. And one of the things that makes it hard to remember that we need really good self-care right now is we may not be suffering in the way that we assume other people are suffering. So we might be employed and say, well, at least I still have my job. Or we may be healthy and say, I don't know anyone that's been sick, or I haven't been sick, so therefore I shouldn't be so sad. But it's the little everyday losses, not to mention this slow disaster movie that we're in, that starts to wear out your bandwidth over time, that nothing is easy anymore in the way that it was, that even the thought of, I'm out of butter requires assuming and assessing a risk that before was a no-brainer. So the self-care, first, I guess I want to talk about what we tend to be doing, and that kind of that adds to what Danielle was saying about the substance abuse. Is a lot of us are engaging in coping strategies or habits that we've always engaged in when we're under stress. It's just that the stress is unrelenting, so we're overdoing it, and that could be overeating, binge watching TV, any kind of substance, maybe armchair shopping. You have a lot of people that are engaging in healthy coping habits that they've had before, like increased exercise, which is super important when you're in a situation where clearly you can't get away from it and you can't beat anything up. So rather than freeze, if you can at least move your body can work through some of those desires to fight or flight. The best coping skills that I can offer people are the things that they know that work for them. So for some people, that means making sure that they have the basics of a healthy lifestyle happening, making sure that they're getting adequate nutrition, making sure that they're getting as adequate sleep as they can, trying to support their physical health by supporting their circadian rhythm, by having food and sleep and maybe even exercise at regular intervals to support their body. For other people, though, coping means getting through this moment the best you can. And this moment might be a really, really hard moment and might mean you have to totally withdraw, go inside and stop for a while. Or it may mean that you take a walk, take a break, take a bath, that sort of thing. There's a billion coping ideas you can find for stress in general just by going on the web, but some of the favorite ones that people like to use, besides exercise and besides the things we all hear about, are introducing a little bit of novelty in your life, to change things up, because there is that unrelenting feeling of everything's the same and yet nothing's the same, and the future is unpredictable. So whatever we can do to be in a now that actually seems like a now, rather than, as a podcast I heard the other day said, an endless February. Do something different, do something new. Take your lunch outside in your backyard instead of inside. Put your hair on top of your head instead of wearing it down. It really isn't even important what you do. I told somebody the other day, and this is actually an old trick, use your left hand instead of your right hand if you're right-handed for the day, and just force your brain to loosen up a little bit. You also want to look for, where you can, lightheartedness and levity, because we know that that deep laughter and a big smile is the antithesis of being scared out of your mind. And if you can evoke that in any way, go for it. So trying to introduce that lightheartedness in conversations, not forced laughter, not pretending everything's okay, but really just looking for moments of joy. And the other two things we know that are antithesis of being freaked out are awe and a sense of deep meaning. So for me, the other night, when it was a bad day and I'd kind of hit my COVID wall for the month, I went to the darkest place I could find within 20 miles and looked at the comet. And for just a little while, our planet and our problems seemed so trivial and so unimportant. So looking for that place of awe. The in-the-moment coping strategies, I don't know if you want to hear those or not, but really are about regulating yourself physiologically so that your body is not giving your mind more feedback that something terrible is happening. We get into a little bit of a loop. When we feel anxious, we tighten our muscles, we over-attend to our breathing and our heart rate, which makes us worried, which increases our breathing and our heart rate, and it gets the cycle going. So when you're that freaked out, when you're to the point where you just feel like, I cannot stand any of this anymore, your goal is not to solve any problem. Your goal is merely to regulate your physiology, to calm yourself physically down. And there's all kinds of weird ways that I do that. I don't know how much I want to demonstrate this here, but I do it with my clients all the time. I might swing my leg way up over my desk and I lean way back and I act like the most bored person in the world. And even if I'm feeling really stressed, my body is giving me the message that I'm safe and that I'm fine. You can plunge your face into a bucket of cold water or ice water, which sounds really crazy, but it induces a diving reflex, reflex, which was designed to protect you in case you were drowning. It slows your heart rate, it slows your breathing down so you're not taking in more water and you're not flailing and struggling around, so that you have a better chance of surviving. And if you do that when you're upset about an emotional thing, your body thinks, okay, I'm slowing my heart rate down, which then tells your brain, I'm okay. It's that chill people talk about when they're drowning, where they just kind of like, oh, well, this isn't so bad. I'm pretty relaxed. So they're definite in the moment physiological thing, but they're psychological too.
Thank you.
I could go on for hours, Stephen, you know that, so I'm just going to let you cut me off. Yeah.
No problem. And kind of in opposition of what you're saying about doing something more spontaneous or out of the ordinary, in prepping for this panel, we talked about creating kind of a routine for those of us who are stuck at home.
Yeah.
And working from home. I think you said you change your clothes at the same time every day or something like that.
Yeah. After work, I change clothes. So it's like I'm off duty now. Yeah.
Yeah.
I put on clothes when I go to work. At first, I did kind of cheat with the pajama bottoms, you know, because who could tell, right? But then I thought it doesn't make the morning seem any different from the night if I'm wearing the same thing. So yeah, routine, both a routine that hangs your day around something so that you know that Saturday is different from Wednesday and Wednesday is different from Thursday. That can be really helpful. So every Tuesday morning at 10 o'clock, I have tea with my best friend from Texas and her daughter. And we don't necessarily do anything heavy. Sometimes we have deep philosophical discussions and sometimes we play games, but we always have tea. And that makes Tuesday, because it's Texas tea time, right? On the other hand, it's also really evolving, right? When we first got into this and we thought this is going to be a couple of weeks, well, you know, I moved my practice into the storage closet, and my chair is super uncomfortable. But I thought, oh, this is just for a little bit of time. Now I've got to make some decisions. If this is going to be my workspace, I want to make it nicer. But I kept thinking, oh, why invest in all this? This will be over soon. Now I realize, let's go ahead and make our space now and our lives now nice, not wait until later. So you want to have maybe some future goals, but really what you want to do is be dealing with reality as it is right now in order to enjoy it. And that means putting in routines that work for you now, not things that you think, well, I'll really benefit from this from 5 years from now if I blah, blah, blah. It's what am I benefiting from in my life as it really is in this moment.
Thank you. And one more question I've got for you, and then maybe a follow-up to that. For our viewers that are parents, what are ways they can help their socially distanced youth, their kids, navigate kind of exposure to media and discussions of racism, violence, and just generally information related to the pandemic?
Wow, that is a really big question. I'm not sure how to address all of it. Let's start with saying that the kids are clearly developmentally very different from adults, and they don't need all the same information that adults need, and they don't need all of it necessarily at once. They might need a certain bit of information when they're 3 and a different kind of information when they're 14. So if they want to know where babies come from, it's a different conversation if they're 12 than it's going to be if they're 2. That being said, I think it's never too early to help people be with the realities of life. And the realities of life is there is joy and there's also suffering, and those are realities of life. And that the human range of emotion matches the human range of experience, which is some things are really hard, some things really suck, some things are really great, some things last a long time, some things are fleeting. So first, I guess, be present to have conversations, to notice cues that a child has questions and be ready to answer them in a developmentally appropriate way. When you're talking about scary stuff, so maybe you've got the TV on and the kid is getting images of violence that's happening, or just unrest that's happening, or maybe they're more than 4 and they are on social media, so they see things, some of which are pretty terrible things. So helping them understand that people are going to have different points of view, but that as human beings, We have basic values and practices that promote health for not only ourselves, but for our communities. And when our communities are healthy, we're more healthy. I think, like, for example, with the conversations around racism and what's happening, I think that's a great conversation to say, yeah, it may look scary that that police and people are fighting, or it may look scary that people are marching in the streets and they're shouting, but they're working toward this greater good where people feel safe and comfortable in their communities, and they're standing up to try to correct a wrong. If that's how you feel about it, clearly that's how I feel about it. Other people might feel differently, but being able to explain that this is something that's been going on for a long time, and people are angry and they want to do something, and that's why they're gathering together. And because they have a lot of energy, sometimes their voices are going to be really loud. Stuff like the pandemic, I think I want to go back to the first part of this question, which is very much more small question. How do you help kids learn to be social when they're being isolated? How do you help kind of fill that gap? And that's a really important question, and it is behind part of why people want the schools to open, because they see that their kids are missing out this major part of development of socialization. I was talking with my Texas friend who happens to be a pediatric immunology specialist, and she has to answer this question all the time. And one of the things she said, and I'd really love to hear what Charlie might add to this, is as this turns from a short-term 2 weeks off of life into a months of a changed life, we do need to reassess our risks and reassess our ability to tolerate risk versus the deprivations we might enter into by being completely risk averse. So something that probably Danielle could speak about as well is you want to maybe look at, instead of abstinence from risk, you want to look at harm reduction. So is there another family that has a small child? Let's say you have a 4-year-old and that's your only child. Is there another family that has a small child that is isolating and risk averse in the same way you are, that's being careful, that's taking care, that you all could be in your bubble together? Could you arrange for family time on Zoom where you eat dinner with the other family, or where you play a small game with the other family, but the focus isn't just on the screen, it's on being together as much as you can be in that situation? So looking for, and this could be, it could be a little bit of bargaining there, which we do when we're in a lot of losses. It could be a little bit of bargaining, but we can look for loopholes that are supportable. How can we help this kid have something? And if we can get good, honest communication with other families, we may be able to have play dates. We may be able to have small groups. We may be able to help kids understand, sure, you can go to the park, but here is the parameter. And maybe it's not the park, maybe it's the slack line in our backyard, but here's the parameter. If this happens, that happens, we can't do that right now. And see if they can handle it. If you're outdoors, the exposure is limited. If a kid screws up, you can pretty much correct that with some hygiene, but that's not going to be correctable if they're in a crowded schoolroom, and it's not going to be correctable if you haven't laid the groundwork for them understanding that close contact right now doesn't work. Doesn't mean it'll never work, it just doesn't work right now.
Thank you. And real quick, before we turn to audience questions, and I'll turn it over to Steve, do you have any local resources you can point to for our viewers, or just especially for people who are feeling pretty hopeless or have felt hopeless even before this all started?
Yeah. Certainly, if you already have a predisposition toward anxiety, which a good 13 to 18% of the population does, or to depression, which at least 20% of us are going to experience in our lifetime, this is not going to be an easy time. And the coping mechanisms that you used before may or may not be available. I do want to emphasize that some things that people seem to think aren't available are available. You can talk to your doctor. Yeah, it's going to be through a screen most likely, but you can talk to them and they can still prescribe to you. You can talk to a counselor. Again, at least for me, I'm really risk adverse, so it's going to be through a screen. You can do self-help. You can do virtual meetings, for example, for AA, for Smart Recovery, and other kinds of substance abuse programs. You can do virtual meetings for your faith community. There are support groups that are available that are very, very specific, because I work with clients from all kinds, who have all kinds of specific issues, like they're living with a brain injury, or they love someone with a brain injury, or they have a specific kind of disease, or they're a single parent who's working and home with their COVID kid. And believe it or not, there are virtual groups out there for all of those people. And you're no longer limited by it's only available to your county. Right now in Benton, Lynn, and I think it's Polk, but I want to say one other county, there's a group of counselors that are offering a free support group for people of color. They have a teen group and they have an adult group. It's completely free. How would you find that? That's the hard part. So if you're not a good Googler, and not everybody is, I would guess, I don't know for sure, but I would guess if you called 211, the information number, they would help you figure that out. And if you're not a tech person, and there are people who aren't, you might try the reference library. I bet they would help you out. I know that I have people write me and say, do you know anything about this? Or can you see me? I'm usually booked all the time. Everybody's usually booked all the time, but I can say, I'll put your information with your permission to my therapist friends group and say, is there a male counselor who specializes in post-traumatic stress and has an opening and is in network with this insurance? And 8 times out of 10, I wish it was all the time, I get 2 or 3 responses that says, yes, I have an opening, I take that insurance, I'm available. Yeah. Library, Google, lots and lots of resources. Self-help is really, really underrated, but self-help doesn't necessarily mean that you just go home in a book. It means you are actively doing something with some kind of often guidance, and that you can get that guidance from a Facebook group, from a Yahoo group, from a telemedicine place, from calling the suicide hotline if you need to. You will get it. We also in town, and Danielle maybe can speak more to this, we have at least 2 that I know of, helplines. There's the text line that has trained peer counselors, or trained what's the word I'm looking for, paraprofessional kind of folks, that they'll text with you for a long period of time. And there's the youth helpline. There's the Trevor line if you're a person who's LGBTQ and feeling in trouble or feeling lonely. So there's stuff that are available through phone, through text, through video.
Thank you so much.
Yeah.
And yeah, Danielle, if you have any to add to that.
Yeah, I think depending on the population, the Oregon text line the crisis text line is one of the most helpful resources we can put out there. Anybody can text Oregon 741-741 and be connected to a crisis peer counselor or support. And Jan is right, they'll text you for hours until they feel like you are safe and your crisis is resolved. So there's a youth and adult crisis text line, same number. So 741-741.
All right, well, thank you both, and thank you, Charlie, and I'm going to turn the questions over to Steve from the audience.
Thank you, Stevie. Charlie, I did want to follow up, and pretty obviously, Jana brought this up, and I was thinking about the question in a different context, but I think it's a good question. What about not necessarily, you're not going to eliminate risk, you're going to make some choices. Kind of what does that look like for folks? Kind of risk management, if you will. What does that look like, Charlie?
Jenna made an excellent point. I think that everyone has to manage and modify and assess their risk. We know our personal vulnerabilities. We know our medical histories. But we also know that lockdown and strict isolation, that is destructive in so many ways. I mean, we've seen what it does to our economy, but we've heard tonight, a number of the consequences that it has emotionally, psychologically, personally, socially. We worry about abuse and neglect. But this harm reduction concept really has value. And so, it's finding your sweet spot, what works for you, having those groups, and managing that bubble. And this is a common recommendation, that you find a group of people of a like mind with very similar risk tolerances, and that's your social group. And you can be with each, you maybe not want to be as close as you were before and hug one another, but you can be with one another. An important component of that is that it needs to be a group of people you can trust, because I think this gets back to some of the earlier points about younger people. Is they say, okay, I'm in a group of 6, so I'm safe. The governor recommends 10 or less. I've got this group of 6. So I have one group of 6 that I run with, and another group of 6 that I mountain bike with, and another group of 6 that I do music with, and another group of 6 or 8 that I work with. And, you've got your risk is really increased. You've got a large group of people, and every one of those people in those different groups has this same kind of multiple group. And so the bubble concept and relatively closed groups are really good, but they need to be people that have a like mind that you can trust.
Yeah, and then it's interesting to me that you're saying that. You were talking about walking in the forest and seeing these groups, and I was thinking, you really think like an epidemiologist, that you're looking at them going, wonder how many groups. It was an interesting moment in prep for the panel. And I'm gonna stick with you for a minute here, Charlie. I got a question from a listener, that reviewer, that I'm not absolutely sure if you're the person that can answer this. I don't think that person is actually on this panel. But apparently this person has preschool kids. Are the preschools making up their own minds because they're private, and then the public's, I guess each preschool can make up its own mind or not, or what's going on with that?
Yeah. This is another one of those balancing acts that we know for people to work and to pay their rent and to keep food on the table. People need some childcare, and it's another one of those issues. It's always challenging in our area. Childcare is expensive. It's difficult to find. Finding one that again matches your risks and your values is incredibly difficult, very, very challenging. But there are multiple models out there. There's multiple businesses offering a wide variety of sizes and interactions, and whether they accept new drop-ins every day or whether it is a closed group of people that you have some level of trust in, that they're limiting outside mixing of their kids too. It's a huge challenge. I don't really have a lot of answers to that, because childcare in our area, childcare is always a challenge. You don't want, especially very young children, being in a closed bubble. That's really not good. Doing it in these circumstances adds, a huge amount of additional anxiety and choices and opportunities. And so, both positive and negative. Yeah, I'm afraid I don't have a much better answer than that.
Okay, and then I'm going to go ahead and I'm going to move back to Jana for the moment. And Danielle, I'd like you to chime in as well, actually, both of you, if you would. Really, the question has to do with pandemic denial. This is the thing. And there are, I don't really know what else to say about that. There are folks that see mask wearing as a political issue or a rights issue. There are people that are in denial that the pandemic's all that bad in one way or another. Jana, could I start with you and then move to Danielle?
Sure. I think that we do our best to protect our own internal sense of safety. And one way we do that is to assume that bad things happen to others because of something that they did or did not do or who they are, and that is going to be somehow different from us. I mean, you probably have heard that about the problem with rape convictions in the past is that people were likely to blame the victim, and the blaming the victim was more likely to occur in some cases from women jurors than from men, and the thinking was it was because we don't want to assume that could have been us. So it must have been something that they had done that we hadn't done. With the denial now, I see it being attributed to people saying, I don't believe it because I don't know anybody who's sick. I don't believe it because it's a political hoax trying to repress a certain view of the government or trying to demonize a certain part of the government. Sometimes what I hear though is, it won't affect me because I'm healthy. It won't affect me because I'm not a person of color. It won't affect me because of my age bracket. Still all boils down to the same thing. It won't affect me, right? The idea that I should be worried about whether it affects you, that can also be a defense mechanism, right? That's your business. You take care of you, I'll take care of me, and I'm not worried about me because it's not going to happen to me. So I think that's a lot of the denial. Some people, the mask thing isn't really about denying that there's a pandemic as much as it is discomfort with wearing the mask. I think that's one of the few legitimate reasons that I hear that someone's saying, I can't wear a mask because I feel claustrophobic, I feel too anxious. As opposed to, I have asthma or I have this other condition. Those lots and lots of doctors figure out how to do that, and nurses. It's true also though with anxiety that you can also get used to it. Even if that's why you can't wear the mask, that you will get used to it if you allow yourself enough exposure. But most people, when they're anxious, they try to avoid what makes them anxious, and then they never have a chance to have a corrective healing experience where, oh, I did wear a mask and I didn't die. So for people who are not masking up because of anxiety, as opposed to political beliefs or outright denial that there's a problem, there really is help. Again, you can talk to your doctor, you can talk to a therapist through telemedicine, sounds like talk to somebody from Benton County, go to the group, whatever, or you can do self-care through exposure therapy and find out how to do that online, talk with other people who have done it. And it basically means you're gonna wear the mask in a super safe situation for a really short period of time, and then you're gonna increase that duration. But just like ER doctors didn't pop out of the womb not afraid of blood and guts, they got used to it through lots of exposure. You can get used to wearing a mask. And from my perspective, that's what, as good upholders of civics, we all want to do, is do what we need to do to take care of all of us, not just ourselves, but the whole community.
Danielle, did you want to follow up?
Yeah, I think just reiterating what Jana said, I think what we have is a situation where people haven't been directly affected by the coronavirus or the COVID emergency, so they don't think it's as problematic as it is. I think you have people that deny it because it's a coping skill. I think people are trying to manage their own stress and anxiety, and it's easier to say it's not happening than to accept that it is happening and that there is actual personal risk associated with it. So I think my perspective is that's likely what's happening with a lot of folks is, one, it didn't affect me personally. I don't know anybody that's had it, so it can't be that serious. And this is really scary. And if I deny that it's happening, then I can manage my own fear. I think we probably saw the same thing 20, 25 years ago when seatbelts were starting to be required and people were refusing to wear seatbelts because they were uncomfortable and they didn't do anything anyways. And that changed when they made it a law and people were starting to get cited. Not that I'm implying that that's what should happen with face masks. Let me be clear. But I think it's a tolerance thing too. I think there's been so much change. I've heard Charlie say several times infodemic. There's so much information out there that people don't know what to believe. People, any opinion that you want to search, you can find something to back up what your thoughts are. So I think people are having a hard time weeding through what's real and what isn't. There's so much spin with the media and with different news resources that I think people just don't know what direction to turn. So it's easier to say it's not happening, it's not real, and then that manages the fear associated with risk.
And you've dovetailed into something where I actually want to go back to Charlie for a minute. Infodemic. Being in the industry that Stevie, our editor, and myself are in, the news industry, media, we are astounded by even legitimate media that sometimes misreports just through doing the story too quickly. But they'll go and they'll correct. They'll do a follow-up. But there's media that is intentionally not paying attention to the facts because they have a bent or not. If you're looking for good, reliable, politics don't matter information, where's a good place to look for the latest on the coronavirus and what the developments are, what we know and what we don't know up to that moment?
Yeah, thanks, Steve. I think still, despite some of the things that we've heard, especially in the last few days and few weeks, the U.S. Centers for Disease Prevention and Control are the world's premier clearinghouse for high quality, impartial scientific information. Now, having said that, some of it is fairly dense. I mean, this is an organization that speaks scientific ease, and if you haven't got a grasp of basic science concepts, it can be very difficult. But I think the majority of the mainstream mass media actually is doing a pretty good job. I think that the large media sites, the large newspapers, even though they often get painted with a brush, get called bias, I think the groups that do very critical analysis of news content find that the major mainstream news organizations actually do cover both sides and do it, or all 27 sides. There's never a both, and compare and contrast. But I think our tendency is, as Danielle very well pointed out earlier, is we tend to search for those that reinforce and meet our preconceived notions. And we listen to and speak into our own echo chamber. And so just as Jana was saying, put cold water on your face, use your left hand or your right hand, your non-dominant hand for a day, find some sources that are out of your echo chamber, see what they say. It will, regardless of the bent, regardless of how you feel that their preconceived notions or their end goals are, it will help you look at your normal information sources a bit differently, and that's good for us.
What do you think? And I'll put a pitch in that Stat News, Boston Globe owns them. What do you think of Stat News?
Yeah, I'm not really familiar with them too much. It's not one that I regularly follow, but from what I've seen, it's very good.
Yeah, Boston Globe has been doing incredibly good work. They've got a paywall. Stat News doesn't. So
yeah, I think that's a very good recommendation.
Yeah, Boston Globe's been doing really good work. And then they do the lighter version of Stat News, which there's no paywall, and it's a good definitive source. Yeah, I think you're good observation. LA Times did incredible work. The Atlantic in the beginning did that 10-piece series. There's a lot of good information.
Atlantic still does really good observational and analytical.
Even if you don't like their politics, right?
Yeah.
Yeah, it's fine. Okay, good. But as I often say, read news. Read real news. Okay, kind of moving on. This one, do you have a sense of what's going to happen in public schools, or we just don't know? Too early to tell?
I think it's a bit early to tell. They're making plans. I think there are a lot of concerns. Frankly, the guidance is still under development. The work groups between public health and the Department of Education, the teachers unions, the education associations is still ongoing, and there's refinement to those guidelines. But again, I think there's going to be options for parents. And it's going to, again, to be finding your own sweet spot, knowing that a lot of families are really going to have to, just like childcare, they may have to settle for something less than what is their ideal, just because they have to be working, and their child has to have a place to go and somewhere to be cared for. And if you don't have a friend in a bubble to put your child in to do remote learning in your non-home environment, or if you are don't have, I think we're in a really unfortunate position in this country of having such limited broadband internet connectivity, and the very families and people that need it the most have the least access, or 5 or 6 kids in a family have to share one computer, and that's no way to learn. And just like a lot of the rest of our world, it's probably going to require some compromises and some really close looks at what the boundaries of your comfort level are. But I do think it's really too early to know what public schools, what the university environment is going to look like this fall. We just don't know where this is going and what the overall risk is going to be.
Okay, and then I would like to move back over to Danielle and Jana. Jan, I'll start with you. Almost conversely, pandemic fatigue, a little too much information potentially. Could either of you speak to that? But let me start with Jana, in fact, and then move to Danielle.
Well, I think we all are pretty sick of it, and we run into the wall at different times. Sometimes, things are pretty good, and we are enjoying maybe gardening more or making more, apparently, sourdough bread. And other times, it's enough. It's information overload. And then I think the thing I want to be mindful of is if we get to that fatigue part, that we don't start assuming a lot more risk just out of the fatigue of it, that we still try to be conscious about our choices and the impact they might have on ourselves and our community. But there's a piece of the fatigue that I think is more about just the difference in day-to-day life that I talked about having to think about whether to go to the grocery store, about having to have all your conversations online. My voice and my body is really tired at the end of the day if I work online all day long. I think people's bandwidths are exceeded far more than they're realizing. So to be able to step back and as I said, like with the comment, step into a moment that is not about COVID. It's still about reality, but it's about the reality that is right now, and the reality that is right now might be that you're really enjoying your burrito. It might be that you're really into your garden. Helps with that fatigue. Main thing is to check in once in a while of how is it affecting your ability to take care of yourself, and how is it affecting your ability to assume the real risks that are out there. And if it's beginning to wipe out either your self-care a lot or your willingness to mask up or to distance, it might be good to talk to someone else and get a second opinion about what you're doing. And I don't mean a therapist, I mean, you know, your roommate, your best friend, whatever.
Okay, and then let me move to Danielle.
I think what I would add to that is for people to give themselves permission to disconnect. It's okay to disconnect from the information. It's okay to not be online watching the news or reading articles or watching the CDC website constantly for new updates or the Oregon Health Authority website for new updates. It's okay to disconnect. And in fact, it's probably healthier to disconnect than to stay connected all the time. So take, 6 or 8 hours and go out for a walk in the woods. Go, do those self-care things that Jana has been speaking about, because, that's what's going to help us have some level of resilience as we continue to move through this. And, I hate to be the bearer of bad news, but this isn't over, and it's not going to be over for a little long time. So we need to figure out how to manage the stress, the anxiety, the over stimulation of information, and just give ourselves permission to disconnect.
Oh, Steve, you're muted there.
I should know better. I'm supposed to be helping to host this. I would absolutely say, as a guy that has just told you and read news, also don't do it all day long, for the love of all that is holy. Walk away at some point. I am deeply in love with news coverage, and I will tell you, I absolutely walk away. I get what I need, and I leave, and I go do something else. I do know people that are plugged into this 24/7, and it's not a good plan. Okay. Let's see. What else have we got? Ah, right. Okay. Charlie, I'm going to move back to you for a minute. In contact tracing, we discussed this younger demography. Do we see any emerging trends that are starting to become concerning, whether it's younger demography or not? Are we seeing, are barbershops an issue? Are bars an issue? Were the protests an issue or not? Some are like, well, it's open air, so it shouldn't be an issue. What are we finding out when you contact trace? Where are you finding out that people are in fact contracting the infection?
Yeah, thanks, Steve. So it's changed. Early on, it was these congregate living situations and work environments. The food packing houses. In our case in Lincoln County, the fish packing and vegetable in the Midwest. The meat packing, where people are working long hours in a closed environment, particularly in those refrigerated buildings. Basically it's mimicking winter, and we know that respiratory illnesses transmit very well in cold, dry environments. Now it's different. As I said, we are seeing it in younger people, and it is driven in large part by socialization. So that's where these pop-up cases and we've actually let me look at my figures. Our numbers for the average number of contacts per case is actually going down. Initially, when we asked people who were you around during this potentially infectious time, we were averaging 6 to 7 people named contacts, because they were in work environments, they were in social environments, they were living environments. Now we're seeing that drop around to 4 because they're parties or they're small living groups. They are the people that you go out to the bar with. They're the people that you run with or drink with. So, and the pattern has really changed, and I think that's both a factor of the precautions that are being taken in those larger environments, but it's also driven by this demography on this younger age group. And it's a real problem for contact tracing. When we try to contact people, lo and behold, people under 30, 35, unlike a dinosaur like me, they don't primarily use their telephone to talk on. And when they get a call, they don't necessarily answer it because they don't recognize the number. If it's somebody I know and they text me, their name pops up on my caller ID, and I know from hard experience not to answer those numbers from an unknown caller. And now that's us. And so, OSU is starting a campaign among their faculty, staff, and students called Answer the Call. There's national campaigns that way. We're having more trouble getting a hold of people.
So this is an issue getting hold of people. I mean, couldn't you simply text?
And we do that when we know that we've got a cell number. But again, if it's from an unknown number, we get spam texts these days as well. And when it's unknown, believe it or not, there have been scams associated with people purporting to be contact tracers. A lot of health departments, us included, have taken to saying, call this number, texting that to a number that positively identifies itself on caller ID and through the answer that it is a health department. So people have some confidence and have some proof, but we've built a great deal of skepticism around the unknown numbers, and we've been trained very well to avoid scams and robocalls, and it's working against us to a certain point now.
Appreciate it. As we're starting to run out of time, I'm going to move over to Jana and to Danielle. And I just want to talk for a minute, or ask you folks to talk for just a minute, just a few essentials of how to build resilience in yourself, as there's just no way around it. This is a challenging year. And let me start with Danielle.
Yeah, so I would say human connection. I think everybody's feeling very disconnected. The social isolation has been really tough on people. I think find a way to be connected to your friends and family, even if it's over a screen. It's not ideal, but having that sense of connection and that sense of not being alone is one of the most important things we can do. Humans are social beings. We need to have that ability to socialize with other people and to feel connected to something. So for me, that's the one thing that I would recommend. The second thing I would say is don't be afraid to ask for help. Everyone's struggling right now. Everyone's feeling overwhelmed. Everyone's tired. Don't feel ashamed to ask for help. Don't feel bad to ask for help. That's why we're here.
Jana.
I really liked a couple of things that Danielle has said throughout the evenings. The human connection piece is huge. We are much more socially isolated as a generation than we've ever been in human history. And we think we're more connected because we get intrusions from people all day long, but it's people talking at us, not with us. And we don't have the kind of conversations and relationships that we used to. So we were already isolated. Now we're way more. We're missing even the casual connections that we used to have with our grocery clerks. So yeah, reach out. Go back to letter writing. Practice phone conversations. Take a communications class through Zoom with some friends where you practice talking about things, host a conversational dinner party online. I've taken, one of the things I've done with a member of my family who is very socially isolated is we paint together. She doesn't like using cameras and that sort of thing, so we just leave it on speakerphone. We're not looking at each other. We're not seeing what each other's doing. We're just kind of checking in, and we may not even be talking the whole time. Might be just kind of like someone else is in the house, but we interact occasionally. Going out to nature, hugely, hugely important, getting away from all the interruptions to our brain and all the messaging and the printed matter. Taking that time off the phone. So I really second what she said. But the other thing is to look at us as a species. We're resilient. We've been through plagues. We've been through wars. We've been through dislocations and forced immigrations and Holocausts. We've been through all kinds of stuff. And we will get through this. It's going to take a lot longer than maybe we wanted it to take, but we'll do it because what we've always done in the past during difficult times is we learn to rely on each other, we learn to trust each other, and we learn to build community together and tackle it as a team instead of as an individual.
Right. And then, the other day when we were doing prep, you said something about even though you have a mask on, you can start a conversation with the checker at the market.
Oh, yeah, that's true.
Because you got to be in there anyway.
I like to chat people up. So maybe that's the only interaction I'm going to have that week with somebody outside of who I live with. But when I do, I'm going to say when I'm checking out, like, how's it going today? Or are you glad it's the weekend? You're going to be off tomorrow? Or can't believe how hot it is, but something, all you're trying to do is to recognize that I'm a human being having a human interaction with another human being. And right. I don't think we do enough of that, but we can do that even during our brief phone calls. We can say when somebody calls a contact tracer, if they do, and maybe they've got the wrong number, we can say, well, it's not me, but it's good to hear a human voice. I hope you have a good day before we hang up, those little tiny touches. One thing that I've been doing a little bit of and encouraging other people to do is to leave safe little messages or communicate in little safe ways throughout the neighborhood. And it may not even be personal, but maybe you leave, that we have a community ceramics box not far from where I live. So maybe you leave a beautiful vase of flowers in there and then people come and get it. Or you go to the little library, you tuck a little note in there with your very clean, recently washed hands saying, I hope you're getting through this okay. Just wanted you to know someone else in the world is thinking about you in this moment. Just little touches to say, we're here, like Horton, here's a who,
Thank you so much, Jen. And then, Charlie, I'm going to be ending with you, and then we have a couple of things we need to announce real quickly or say real quickly. But Charlie, I'm going to be ending with you. And really the question is, and I kind of already know the answer, and maybe everybody does, but we could use the reminders. That short list of if you're going to do nothing else to prevent transmission, to prevent getting ill, what are those things, Charlie?
So I think that, the public health mantra at this point is distance, distance, distance. That 6 feet. A mask certainly helps. And again, gets back to Jana's point. We need compassion for one another, and we need a sense of responsibility, and that's what wearing a mask is. We know that yes, there's a certain amount of protection for you, but it's about protecting others. It's about a sense of social responsibility, and keeping that arm's length distance, but making eye contact, having some friendly interaction, having some compassion. I think it really is about compassion. We've got to get through this together. We've got to help each other through it. Frank Zappa, I'm old. Frank Zappa had this, help the other poor sucker on their one-way trip. Be nice to people, smile with your eyes, and don't crowd people. You're going to make them uncomfortable, regardless of your own feelings. So really be thoughtful and compassionate, because that's what's going to get us through. And that's also what's going to protect each of us. It's good public health. It's good psychological health. It's good mental health. It's just good social behavior.
For our viewers, we've had these panelists for other panels before. They're always amazing. Tonight, no exception. You folks have just been wonderful and informative. And I really appreciate you taking the time out of your personal schedules from 6:30 to 8 o'clock on a Tuesday evening. Thank you so much. Stevie, back to you.
All right. Yeah, I want to echo that. Thank you all so much. I really enjoy every time you're on our panels, and it's just as good live on the screen as it is in person. So thank you. And a big thank you to our viewers, of course, out there watching. Thank you to all the people at the Corvallis Advocate who are putting in all the good work behind the scenes, and to our supporters for making this night possible. And thank you, Steve. And with that said, this CitySpeak is concluded, and have a good night.
Thank you, Stevie, and good night.